Okay, so chapter 23, drugs for Parkinson's and Alzheimer's. Again, we did some of this stuff, so we're going to just kind of move through this kind of quicker. So we know that with Parkinsonism, that there's some kind of an imbalance with dopamine and acetylcholine, okay? So that's what we need to know as nurses, is that there's an imbalance of the dopamine and the acetylcholine in the patient. And so we're not really sure why the degeneration of the neurons happens. We have different theories that are out there, but we just know for sure that there's some kind of imbalance with these neurotransmitters. So the different characteristics, which we talked about, and we are all listed right here. That's going to end up being important for you to know and to understand what you're going to see. The different treatments that are available for Parkinson's. We're going to focus on the levodopa that we talked about mostly, but you're going to have these other ones as well that are going to be in there that you're going to end up needing. So not for this test specifically, but you'll eventually need to have all of this stuff as you make your drug cards. So I will point you to the ones that you're going to need to know for this test, but you will, as time goes on, you'll be adding to all of that. So the anticholinergics are ones that you are going to see in the clinical sites, and so it would be important for you to have your drug cards made up for the anticholinergics at this point. So they're going to inhibit the release of acetylcholine. So you have your list right there. You have your list of your cogentin, your artan, and then you have your action right here as well. So that's inhibiting the release of acetylcholine is going to have the following effects: reduce the rigidity and some of the tremors. Minimal effect, but it has a minimal effect on the bradykinesia, which is the slow movements. And so we can also use it for when we induce the Parkinsonism, which we talked about that when that happens with antipsychotics. So this was also used in with that as well. So the cogentin especially you'll see used for patients that have some kind of drug-induced Parkinsonism. So your anticholinergics, you have your nursing interventions listed here for you. Yeah. Oh, never mind. I thought I read something else. You can tell probably. I'm getting. It's taking a toll on me. All of this screencast, but anyway, here are your nursing interventions for the patient. We did some of this stuff in class together, so you can read through this. I don't need to reread it. And then remember again, always go over your parts for your assessment, nursing diagnosis, planning, interventions, and evaluation. You will see stuff on that, so it's important for you to know and understand. So then the dopaminergics, so this is where the carbidopa, levodopa is going to come in. This one you're definitely going to want to make a drug card for dopaminergics. This is going to increase mobility, so this is going to help. This is going to end up being converted to dopamine and trying to balance the dopamine in the person that has the imbalanced dopamine that's being shown with Parkinson's disease. So here's your side effects. They're all listed right out here for you. And then this is cool. I was reading through this. So it talks about, let's get this at the bottom. When levodopa is used alone, only 1% reaches the brain because 99% of it converts to dopamine while still in the periphery. Okay, so while it's still in the peripheral nervous system, it's been converted over to dopamine. Therefore, it didn't reach the brain in order to turn into the dopamine and help up there with the leveling everything out. But when they combine carbidopa with levodopa, the carbidopa can inhibit the enzyme decarboxylase, which is the enzyme that's helping the levodopa convert to dopamine. So when levodopa is used alone, this enzyme comes in and helps it convert over to dopamine. But when we use the carbidopa with it, it inhibits that enzyme while it's still working through the regular periphery blood system. And then that makes it so more levodopa is allowed to make it to the brain and then convert into dopamine. So I thought that was pretty cool. If you need to rewind me and listen to me say that again, go ahead and do so, because it makes sense if you, kind of talk it through and reread it. You can see what it's doing, and so that's going to be its function, and why this is why we end up using the carbidopa, levodopa, instead of just the levodopa. Okay, so amantadine is also a medication that we use as a it's a dopamine agonist. Okay, so it's going to bind with and help with dopamine, the action of that. So you can see amantadine is also an antiviral drug for influenza A. That's just a little side thing. We actually also use this in where I work in Brighton for restless leg syndrome. So it's also used for that, and every now and then for some anxiety as well. So it's got other things, but it stimulates dopamine receptors. Okay, it's just helping. It's an agonist, so that's going with, versus antagonist, which is going against or blocking. It can be taken by itself or in a combination with the levodopa or an anticholinergic. And so it can treatment of early Parkinson's early treatment of Parkinsonism as drug tolerance develops, and it can help for improving symptoms. So here you go for most all of your drugs. This is going to be for all of them, your nursing interventions that we're going to do with our patient. And so actually I didn't exclude any drugs. So sorry about that in the beginning, saying I was going to do that. I'm not going to do that. So all three classifications of medications are going to be important for you to know, because all of them you're going to end up dealing with in the clinical site and as a nurse. So we're moving into Alzheimer's now. So the pathophysiology of that is, we know that it's incurable dementia illness. It's chronic and progressive. We talked about early, middle, and late stages in class. The onset can occur between 45 and 65. We know we have these neurotic plaques that form and tangles. You're going to hear that word tangles a lot when it's used about Alzheimer's disease. So you can see that right here in the second portion. You have these neurotic plaques, and then you have these tangles. So for whatever reason, up here you have these nice smooth movements, and down here you have all this, it's like a tangled mess, basically. And the unfortunate thing with this is that we don't see this until after somebody has passed away and they do an autopsy to see it. So, but this is what we will see in somebody who has had Alzheimer's disease versus someone who has not. So just remember that tangles and the plaques that are going to happen with Alzheimer's disease. So here's your symptoms of Alzheimer's. It's all listed out for you. Some of this we talked about in class the other day. Remember, safety is going to be a huge priority for this patient. And let's move this really quick. So there we go. And then I'll fix that and post that for you guys. So we have acetylcholinesterase inhibitors. So like Cognex, Aricept, Exelon, you're going to see these. You will see all of these. So it's going to allow more acetylcholine in the neuron receptors, and it increases cognitive functions. So we use this for mild to moderate Alzheimer's disease. We sort of talked about this a little bit the other day. I'm going to move this also. So with all of your acetylcholine, ACHE inhibitors, you can just kind of follow this for your drug cards, and this is just such a bummer. So you have side effects and adverse reactions that are going to be seen. These will all be right here for you. You can use these as you make your drug cards, and then this you don't really need this specific med, because they all pretty much are going to be close to the same. And so make sure you go through your processes with that through your book. I think I'm going to end this right here and then do your last one. Again, if you have any kind of questions or anything at all that you want to talk about further or clarify or anything like that, be sure to post your questions in the discussion board.